Cognitive behavioural therapy, or CBT, is a treatment method for treating a wide range of emotional problems, including depression. And basically what it is, it really helps you look at how you think about particular situations, because research has shown how we think impacts how we feel, and how we feel very often impacts how we behave as people. So what CBT helps you to do, it helps you to explore your thinking processes and maybe look for more realistic ways of how we look at and consider particular things with your therapist. It helps by maybe doing behaviour experiments or by trying out new things, and then together with your therapist talking about how those things went and realistically appraising things maybe in a different way. Cognitive behavioural therapy, like many other forms of treatment, has particular principles which are important. I suppose the key principle is that about building up a good therapeutic relationship with your therapist. It's important that you as a client can feel comfortable, that you feel listened to, and that there's a sense of warmth and empathy between you and your therapist. And if you have that, it helps you to feel more comfortable and allows you to talk about how you actually feel. As well as that, it's really important that there is what we call collaboration, or in other words, that you work together as a team, because that's really important, that you feel listened to and that you can work together at exploring the issues which are impacting you at a particular time. It's important to identify particular goals and to be focused so that you know where you want to work towards, where you feel you want to be. So setting goals or targets are important, and that is something you and your therapist will discuss in the early sessions. Very often in session, you and your therapist may agree to do what we call homework, in which you and him together will look at things maybe that you can experiment with or try in your home environment or outside the therapy session. Because doing that, you maybe learn new things, you maybe can identify new ways that have helped you in managing your mental health condition. And together with the therapist, it's important to identify a suitable and appropriate homework that maybe will be helpful for you on the journey of recovery. How many sessions of CBT are required very much depends on you as an individual, and obviously the condition and problems that you're experiencing at a particular time. I think the key and important thing is that you feel listened to and that you're allowed time to work, develop and seek other ways to manage problems that are impacting your life at a particular time. It's important to allow anything between 30 minutes and an hour for each session, and that gives you a time to explore in a structured way key issues that are important for you. And I think that's the important thing, that you don't feel rushed, or that you don't feel there's a set time scale that maybe puts you under pressure, that allows you to explore things that are important. What actually happens at a CBT session is generally quite similar for a lot. I think the important thing in the initial session is, let's identify what is your problem. What are the key problems that are impacting you? And it's important that your therapist gets a good sense of the issues that are impacting your life at a particular time. He'll look at contributory factors, such things as not only your current mental health, but maybe issues involved in your personal life, your family life, issues around your social interaction. And those will be key in identifying the particular problems and how they maybe are impacting or infringing on your current condition. He will also maybe look to explore current coping strategies. What are you doing at the moment that may be helping? Or maybe there are things that you're finding make the condition worse. And those are important to identify in the early stages of treatment. Your therapist will also do what we term a mental state assessment, in which he will maybe assess your current mood. how you're thinking about things, how's your concentration and motivation. He may also want to explore things like your current pattern of sleep, and those are all helpful in getting at what we call a holistic or entire picture of how life is impacted by your condition. It will also be important in those early stages of assessment to identify what we term goals, or things that you and your therapist feel would be important to work towards. To get access to cognitive behavioural therapy, it's important that you speak to someone like your GP, and he will be able to advise you and explain what cognitive behavioural therapy is and how it can help in managing your condition. It's also important to feel a sense that you want to get involved in it, that you feel it's something you want to explore, and that you have a motivation to give therapy a chance. And I would encourage you to think about talking to your GP or a healthcare professional who will be able to give you further advice and guidance. Sometimes people will ask, if I'm taking antidepressant medication, can I still have CBT? The answer to that is yes. I would encourage you to speak to your healthcare professional or your GP to ascertain or establish, is medication important? Because very often medication can be a complement to the actual CBT session. And indeed in some forms of depression, like maybe a severe depression, medication will be important. CBT alone can be very effective. CBT with medication can also be equally as effective.